G&H Hospital is in the preliminary stages of adopting an electronic health record. The organization's leaders realized that they must update their antiquated systems in order to remain one of the highest quality healthcare providers in the DC metropolitan area. The hospital's overall mission for the project is to plan and implement an EHR that meets the future service needs of the hospital. They would like implementation, which includes both configuration of the system and training, to be completed within 18 months of the start date. Hospital leaders want a system that is essentially paperless, and they will not consider the EHR a success unless their employees understand how to use it and know where to seek help if problems arise. The system must be user-friendly, and implementation needs to take the importance of training seriously. We have put together an implementation plan for G&H using Microsoft Project, through which the organization can view the entire process. As you can see here, implementation will begin on July 2, 2007, and it will end on August 7, 2008, taking a total of 289 days, staying well within the organization's 18-month goal. Here, you can also see the 7 different subtasks that must be configured, as well as how long implementation will take for each of those subtasks. For example, the laboratory subtask will take 42 days to complete, from September 4th through October 31st. All subtasks are dependent on the completion of the subtasks before them, meaning that clinical information systems, the final subtask, cannot be configured until all of the other 6 subtasks, which include patient information management, laboratory, pharmacy, radiology, imaging, and nutrition food services, are implemented. You can see here that the subtasks have units. For example, patient information management must include the Enterprise Master Patient Index, patient registration, admission discharge transfer, and patient scheduling. Each unit requires configuration and training before it is considered complete. Certain units are dependent on the completion of previous units. For example, under the laboratory subtask, anatomic pathology cannot be implemented until after microbiology and chemistry are complete. Here is another example under the pharmacy subtask. Electronic medication administration record cannot be implemented until inpatient-outpatient pharmacy is complete. Thus, the project calls for the electronic medication administration record to start configuration process on November 13, 2007. This is 1 day after inpatient-outpatient pharmacy is scheduled for completion. In some subtasks, the units are not dependent on each other's completion. For example, in radiology, the general radiology and nuclear radiology units can be implemented at the same time. Thus, they have the same start dates, September 4, 2007. The next slides outline the project for the final 3 subtasks: imaging, nutrition and food service, and clinical information systems, which calls for the lengthiest implementation due to its large number of subunits. As in all projects, we strive to finish tasks ahead of schedule. Here you can see that it is easy to adjust timeframes within the project. For example, the original time frame for configuring admission, discharge, and transfer is 30 days, but here we show how finishing it in 20 days cuts the entire project timeline by 10 days, from 289 to 279 days. This will make it easy for the leaders at G&H Hospital to understand where changes occur during implementation scheduling. Overall, this method of project planning is very easy to follow. There is little room for confusion or going off track due to the step-by-step nature of the plan. You know what tasks cannot be started until certain other tasks are complete. The software also makes the plan easy to adjust. Stakeholders and project managers can clearly view where the project is ahead of or behind schedule, allowing them to ask the right questions regarding problems. In addition, the software allows you to see exactly how long training should take. Thus, the hospital can plan for staff changes during those periods. With the easily adjustable nature of the program, training times can be lengthened if the need arises. Overall, this method of project planning is very easy to navigate. G&H Hospital will find the EHR implementation process to be very smooth if they use this planning software.